For many who fight for our country, the sights and sounds of combat can last long after they've left the battlefield. Using technology, the Virtual Reality Medical Center based in California is recreating combat scenes that help our returning veterans deal with their PTSD. We recently went to their San Diego office to get a first-hand look at this virtual reality therapy, and we met Iraqi veteran Akil Crawford. He told us of his struggles returning home.
Once I came home, I would say irritability, problems with resolving conflict between my significant other, and as well as problems with resolving conflicts at work. That's where it's probably started, and then the nightmares and that sort of stuff didn't happen until later.
Akil Crawford joined the Navy in 1995, then was deployed to Iraq in February 2004. He was a hospital corpsman, second class, or HM2 for short. After serving for 2 months, Akil experienced something that would stick with him forever.
I was in a Humvee soft top and was hit with an IED, roadside bomb in Al-Assad, Iraq. And the bomb was approximately 5 feet from my door when I was hit. Had a perforated eardrum, a concussion, neck injury that wasn't figured out until about a year later. But I continued to serve at that time.
Akil served for 6 more months after that near-death experience, and in September 2004 he came home. But his struggles came home with him. Everyday events would bring him right back to the war zone.
I had a roofer putting in a new roof. The sound of the nail gun, I dropped to the ground. Driving down the road, and there's a structure of rocks that someone has constructed on the side of the road. Totally throws you off because they used to hide bombs and such things. Here in San Diego, there's a camera system in order to get people who run the red lights. When they do that at night, there's a flash so they can actually get a clear picture of the license plate. But that flash is what usually precipitates before an actual explosion. And in that 3-second window of the flash, and then it takes me 3 seconds to tell myself it's just a flash, it's not an explosion, and you can move on. It's like a mini flashback, so to speak.
This constant anxiety led Akil to find his own methods of handling it.
I have to say I drank a lot in order to try to dull down my over-awareness, to be more relaxed, when in fact I needed to actually talk to someone and find out what was really going on and find new techniques in order to do just that.
And in his darkest moments, Akil did consider taking his own life.
I'd say over the past 10 years, maybe 6 times in the last 10 years where I thought about it, my life sucks. In our heads, we always blame the PTSD and so on. And maybe the PTSD may be what's causing the problem, but that's a final solution for something that is temporary. You don't want to take your own life.
When asked what suicide would represent to him,
giving up, failure of mission, things that are not in the qualification manual for being a Marine or a sailor.
when we come back, we're going to see the virtual reality simulation in action, and we'll see how it's helping Akil handle his anxiety and overcome post-traumatic stress disorder. That's next.
Okay, we have insurgent to the left, in a pickup truck. Stake out that pickup truck.
Akil's treatment was performed by Dr. Dennis Wood, a retired Navy captain and now a clinical psychologist. Dr. Wood has treated more than 50 veterans suffering from PTSD. The therapy consists of what's referred to as a HOP. That's another word for a mission. During the session, the patient is exposed to high-level stress and then taught how to manage that stress. We got to witness a hop with Akil Crawford.
We're going to start a hop right now, and hop is going to be, you're going to be in the gun tub of a Humvee somewhere in Iraq. There's a number of, by intel, there's going to be a number of elements that you're going to come across. And with you as the gunner, your job is to take out those insurgents and again to protect the convoy. Now again, this isn't exactly what you were doing when you were in Iraq, but as we've talked about before, we don't have to have a one-to-one comparison in order for the treatment to be effective.
During the hop, respiration, heart rate, perspiration, and GSR, our skin conductance, are all monitored. All of these readings are referred to as the biofeedback.
The blue line is breath rate, and this is set up right now for about 8 breaths a minute. And then the red is heart rate. One of the ideas that we try to do with our warriors is we want breath rate to dominate heart rate. So we want the blue above the red. Right there it's even, right there it's a little bit above. Here heart rate is above breath rate.
Once all the equipment is set up, Akil is sent into his first mission.
Civilian to the left, civilians are non-engageable.
Roger.
Okay, we insurgent to the left in a pickup truck. Stake out that pickup truck. All right, typically keep your eye open down the road. Insurgents behind a barricade. That red car on the side of the road is a non-combatant, but keep your eye on that non-combatant. Insurgents to the left and the right of the convoy, suppress their fire. Suppress their fire.
As the hop continues and Akil's biofeedback is showing an increased heart rate, Dr. Wood has him use meditation skills to bring his heart rate down. This relaxation is defined as the decompression phase.
And usually what we do is they're engaged for about 3 minutes with the threat element in terms of the exposure therapy, and then about 3 minutes to 5 minutes of working on using their meditation skills to get their respiration and heart rate back down. And again, HM2 is back down to 2.7 or 7.7 right now.
After another exposure and decompression phase, Dr. Wood adds a new element to the third phase: have Akil talk about his specific incident while dealing with the stress elements.
We were on convoy as part of the combat train. We resupply the ground units, and as we were rolling down the road, we saw a suspicious white vehicle. I relayed to my chief. The vehicle made a right turn and took off like a bat out of hell, and next thing you know, explosion.
We spoke with Akil after this hop.
Akil, clearly your readings showed a lot more stress as you were talking about your particular incident in country and while you were in the stressful situation. Can you tell us what you were feeling at that moment?
Well, a combination of my memories and the virtual reality, which is very close to reality, brings me back to actually going on convoy and whatnot. So it becomes more real. The mind is very powerful and can make things real that are just memory. So it became very real in the moment, and I can definitely, I felt the anxiety and everything about the situation, anticipating the explosion.
Dr. Wood believes that managing the anxiety caused by PTSD is the key to lowering suicide rates.
There's certainly a relationship between PTSD and suicide. I would imagine if we could treat PTSD more successfully, then by definition the desperateness and the depression rates that occur and are related to PTSD, they would come down, and that would bring the suicide rate down.
Since the treatments, Akil has noticed a change with his own suicidal thoughts.
I've had the thoughts, but because of the treatment, have never planned anything, never gone through anything. I've expressed those feelings to Dr. Wood and to my other therapist, and we've managed accordingly. But it does happen. This is not, once again, it's not a cure, it's just a way of managing it.
We want to thank HM2 Akil Crawford for sharing his story with us. For more information on the Virtual Reality Treatment Center, please visit vrphobia.com. Coming up, we're going to find out how man's best friend can help veterans heal and maybe even save lives.